Good afternoon, and welcome to today's SAMHSA-sponsored webinar titled Collective Impact, Working Together to Support Individuals with Serious Mental Illness, SMI, and Serious Emotional Disorder, SED, and their families, presented on behalf of the National Federation of Families. Today's presentation will be recorded, and the recording link, slides, and a certificate of attendance will be sent via email to everyone who attended today. Closed captioning is available and can be viewed by clicking the CC at the bottom of your screen or by clicking the link in the chat pod to view in a separate window. We also have an ASL interpreter who should be spotlit on your screen. During the presentation, please add your questions and comments in the chat box, and questions will be asked out loud for the presenters to answer at the end of the presentation. When the presentation ends, please take a few moments to complete a brief survey that will show in your browser as you exit the platform. Thank you again for joining us, and we will now begin today's presentation.
Okay, thanks for that. And welcome, everybody. We're so excited to have you with us, and I love seeing people from so many places. For those of you who don't know me, I am Linda Gargan. I am the Executive Director for the National Federation of Families, and we are so honored to be able to bring this presentation on behalf of SAMHSA to you today. Our speaker today is amazing. Paul Schmidt has been working in this space for quite some time. And I typically let people introduce themselves because I think people do a better job when they do that. But I've got to tell you this, I read his bio. He is one of the busiest men I've seen for a long time. But here's what you need to get him to tell you. He obviously is wonderful at time management because, little secret, he has 5 children. So ask him a question about that as we go on. And I will turn this over to Paul, and he is going to either introduce you or bring you up to what's newest in the field of collective impact. Paul, it's all yours.
Great, thank you. And just as we get started today, the learning objectives we have are to learn the approach of collective impact to move larger population and systems change, incorporate the best practices in building the strategy, structure, and collaborative leadership that support effective collective impact, and consider ways that collective approaches can be used to improve outcomes of individuals with serious mental illness or serious emotional disturbance. And so I'm going to do my best to share with you some of the experience we've had at building that. My role is Senior Advisor at the Collective Impact Forum. And before that, I spent 21 years building a national nonprofit called Public Allies that did leadership development in 23 cities across the country, but also have been involved in the Asset-Based Community Development Institute, where we've done community building work for the last 30 years, and have had many other roles through my career. But for the last 11 years, what I've been trying to do is work with coalitions around the country and some globally to try to move population change. How do we actually move the needle on big issues in our communities where we often see there's great programs, but we're not seeing actual measurable improvement for the populations as a whole? Collective impact, the National Federation of Families, did a slide here, just talk about, like, you've got all these systems, organizations, and service providers working with the populations that you serve. And it's a very siloed and fractured environment. The providers and systems and support providers don't talk to each other. For the person, it's just a bunch of individual actors they're working with in different spaces to do things. And it's unclear how they work together to make experience for the individual more seamless, more effective, and help actually move outcomes at a bigger level for all people. The way that I came into collective impact was through a role I had at the time working on how do communities solve problems. And one of the things that happened was in April of 2010, I opened my local newspaper. I'm based in Milwaukee, Wisconsin. And we had the worst reading scores for African-American children in the country. And that same day in the afternoon, I received the largest, an email newsletter from the largest youth serving agency in our city, boasting about all the outcomes it was achieving with the 15,000 children they serve. And that disconnect really hit me. If all these great programs, and I knew a lot of the programs, my kids have been in the programs, I had placed people with them, I had lots of experience with lots of great youth serving nonprofits in the city. I'm like, how can we have so many great programs, but when you add it up, we still have a result like this? And so at the time, I was part of something called the White House Council on Community Solutions, and I went back to them and said, hey, let's look at where are cities that have moved a needle. Not just there's a program that's accomplished something significant with a small population of participants in a program, but where is there a city where the graduation rate's up, or where teen pregnancy is down, or where infant mortality has been addressed in a way that has gone down substantially, or et cetera, et cetera. But like, where are there communities that have actually moved the needle? And our council looked at 20 cities that had moved a population level measure by 10 points or more. And one of those happened to be in Milwaukee. And the United Way here and the City of Milwaukee Health Department back in 2006 were trying to address teen pregnancy. Milwaukee had been number 1 or 2 in the country for over 2 decades in teen pregnancy. And at this point in 2006, the rate was 2.5 times the national average. Just ponder that for a second. 2.5 times the national average. And we had, they pulled together a summit of everyone who worked on the issue. And again, all these groups got funding. They all reported outcomes. But how do we still end up 2.5 times the national average? They looked at data together. They created 3 strategies and worked on how could they get everybody rowing the boat in the same direction and integrating to do these solutions across the city. And the result was over the next 10 years, there was a 75% decline in the teen pregnancy rate. And while the national rate fell, it fell further, and it went from 2.5 times national average below national average in 15 years. And that's what collective impact is about. It's not about how do we collaborate better? It's about how do we actually move change at the population and systems level. It's a network that learns together, aligns, and integrate actions to move population and systems change. Typically, we think of collective impact as having 5 elements: a common agenda, which is basically a strategy that's at the level of complexity and scale needed to address the population. I can't move if I'm trying to move infant mortality and in 5 zip codes where there's 18,000 women of childbearing age, I can't say we're going to do an outreach program to 20 people here and we're going to have a mother mentoring program for 10 people here. It's like, what would it take to move at the scale of what we're trying to move? So the common agenda is a set of strategies that'll be bigger than any one organization or program that a bunch of groups will do together, that together add up enough to move the change we're seeking. Once we have that agenda, we have to be able to measure our progress in real time. And the thing we like to highlight here, it's not measurement to evaluate on the back end. It's measurement to manage in the present. Do we need to be putting more resources in this part of the community than that part of the community? Do we need to be putting more resources into this school or that? Is this strategy not achieving its stated goals and should it be stopped? It's using data to make decisions, not just using data to evaluate on the back end. Third is mutually reinforcing activities, which is how we actually integrate to address issues and work as a system. One of my favorite examples of this is an eviction prevention group here that they have organized now a one-stop shop online, as well as by phone and in person, that represents 14 organizations. So if someone's going through this crisis, they can get, rather than calling each place to get help and trying to navigate all the systems, they go to one place where there's a navigation system of 5 people. that represent 14 organizations to help them get everything that they'll need to support them in that moment. That's what it means to be mutually enforcing, is how do we work like a system instead of like a lot of independent organizations and providers. Doing all this takes a lot of communication and engagement, and it takes some type of backbone staffing who facilitate, coordinate, and manage the network. And so that's the typical definition we use for collective impact is those 5 elements. And again, they're very adaptive. Collective impact is not a model. It's not a thing you do and about fidelity to a model. It's not about doing the model right. It's an approach and set of practices that, when done well, give you a chance at moving the needle on bigger change. And in fact, we can go back to coalitions back in history and find a lot of these same practices. They're not new, but they're things that, when done together, give a chance to actually move the needle. And so we like to make that point that some people come to me and say, oh, we're doing collective impact. We've got this, this, this. And I'm like, what's the change you're moving? And they can't talk about the change they're moving. And I'm less concerned about how one does these 5 things than that they're moving change. The idea is that you're using these practices in the best way possible to move the population change. That's the ultimate result. Over the last decade, I had the privilege of working with the Advancing Healthy Wisconsin Endowment, which is a funder in the state of Wisconsin, to support 10 community coalitions across the state that work on behavioral health. They have a website, Advancing Behavioral Health Wisconsin, that outlines the work of these 10 coalitions and what they accomplished and their lessons and their process. So I encourage people to check that out. It's Advancing Behavioral Health Wisconsin. And I'll use some of those examples just to talk about ways in which they were able to create coordinated work and collective work. In Appleton, Wisconsin, one of the things that was highlighted in that effort was they created one health center for teenagers where the different medical systems were all in one space. They almost each had a wing with a common entrance. And so someone coming for help didn't have to navigate the different insurances and which providers. They could go to one place and all of the health systems were there and they could work across them. And it's an example, again, of what's possible when we actually work to solve the problem for the person and move our systems in service and coordination of the outcomes. What's different about collective impact compared to ways we work, we like to use the metaphor, of let's say, the Hilton and Airbnb. And it's not endorsement of either company, it's a metaphor. But if I stay at a Hilton anywhere in the country, it's going to be a pretty similar experience. It's pretty controlled. Someone centrally has decided what shampoo is in the bathroom and what TV's on the wall and what the pillow's like and all of that, right? We're used to working in organizations. And in organizations, we can control what our organization does. We can control at some level the outcomes we try to produce. Collective impact is a network. And we have to operate as a network, which we're not used to. And it's more like Airbnb in this case, that Airbnb does not decide what shampoos in the bathroom or what pillows are on the bed or what TV's on the wall. But what they do is they create a platform and a set of standards, and their job is to support people to achieve those standards together. And that's more like a network process where we can't control the work. But what we do is we try to create platforms and systems to support people to achieve things together. And so the problem we often see is that people fall back on organizational behaviors instead of switching to network behaviors when they do collective impact. So we're used to the idea that the leader sets a vision, that the organization tells us where they're going. And so a lot of collectives say, oh, as a backbone leader telling us what the plan is. No, the job of the backbone leader is to steward the network to agree upon a vision and change. It's the network that creates that strategy. We're used to focusing on program level results. What are our outcomes? What are the outcomes our programs are achieving? In collective impact, we're switching to focusing on pursuing population level. So again, program outcomes are a contributor at population level, but the goal is that we're trying to move the population level change. And finally, we're switching from, we're used to serving on advisory committees. We get around to collective impact and we think we're just going to a meeting to advise the staff and the staff do the work. No, it's the opposite. We're actually going to meet and we're the ones doing the work. And we're at the meeting to figure out what we're going to be doing during the next 3 months and to align and manage and work together on these things. And the staff's job is to align, motivate, and manage us. We're not advising the staff, they're advising us. We're the ones who do the work. And so it's not a meeting where we go to just like listen to some reports and advise. It's a meeting we go to like coordinate our work and make decisions about what we're going to do when we go back to our organization for the next few months. So again, it's this shift from thinking like an organization, or even that the backbone is, to thinking like a network. It's a shift from that's really important in collective impact. Thank you, Angela, and welcome, Ann. I'm trying to slow myself down a little bit, so I'll do my best. I'm a fast talker, but I'm gonna try my best. So I'm trying to slow down. So the other thing that's really important to understand is that collective impact is change. And we've always loved this part too, and it's everybody wants change. But of course, if you want change, you have to change. And no one wants to change. And who wants to lead other people to change? No one, right? But this work is change. We do collective impact because our current efforts aren't doing enough to move the needle and accomplish the results we want for the populations we serve. And so right off the bat, we're doing this work because we realize that if we keep doing more and better of the same work, we're not going to get to the big change we want. That we have to do something different. And there's a sense of urgency to do that. The second is a really important point, which is most coalitions we join to protect our current work. So when I led a national nonprofit, I was part of a national coalition. And we would advocate for the federal funding we received. We would work on regulations together. It was all about protecting our existing work. When you join a collective impact, you're actually joining to change your work. That it's not to protect what you already do. It's to take on new and different work to move that common agenda forward. And so we join collective impact to change our work. And what is that change? We may have to change our outcomes, our expectations, our practices, our work styles. We have to align our work with a common agenda, which is different. So it's important to keep in mind this shift from organization and network, and also the mentality that doing collective impact is a change management process. You know, again, when we worked with these 10 coalitions on behavioral health in Wisconsin, there was often early on resistance because this is difficult work again. And a big part of what we often see is the challenge of trying to keep partners happy and not allowing difference, or not allowing, and we're going to talk more about culture later, but the idea here is that this work's change and it's kind of complex and difficult. And you're going to have to make hard choices. And so doing this work, again, is really difficult. Early on, a lot of us like to work in coalitions where we want to make everyone happy. And if we actually make hard choices about where to focus and what the work is, not everyone's always going to be able to stay at the table, and that's okay. Some of the things that those groups did, and again, I encourage you to check out the website, was working to reduce crisis calls, reducing suicide attempts, increasing school belonging, and decreasing alcohol and drug use as impact that they organize their communities around. So after doing collective impact for 10 years, there were 3 key lessons. We were asked to write a follow-up article to the original article on collective impact in the Stanford Social Innovation Review. And the piece I wrote that was kind of my lessons over 10 years was 3 key lessons. One is that clear strategy guides clear commitment, that the more specific and targeted our strategy is, easier it is to manage a coalition because the coalition knows exactly what it's committing to and what it has to do. The more vague or aspirational our strategy was, the harder it was to get people to stay committed. The second is that form follows function, that we first build the strategies and then we figure out the right people to get around the right tables to do the strategies. We don't build the strategies around the table, again, trying to keep people happier at the table. We figure out the right strategies to move the needle and then figure out who needs to be on those tables. And some of them might be the people who've been involved. Some of them might be new, and some people who've been involved might not be the right people to move it forward. And that's okay, because we're about serving the outcomes and result, not serving the participants in the process. And finally, cultivate strategy for breakfast. That, as I said, if we're making hard choices, if we're moving difficult decisions, we have to have trust. We have to have accountability. We have to make sure that people feel belonging in the coalition, that people feel there's a process that everyone's treated fairly, and all of that is important to create a process that works well. So I'm going to first walk through each of these to kind of guide you through best practices and collective impact. And the first one is about clear strategy and what we mean by that. And so to us, it's three things. One is that we have a clear, bold result that people care about and an indicator that can be regularly assessed. This gets harder in mental health, but again, there may be systems indicators we can look at that would be very helpful to us. But in some issues like teen pregnancy or mortality, it makes instant sense. Or grade level reading or school graduation, everybody knows what those are. Everyone can feel a sense of urgency about them. On things like behavioral health, it can be more complicated because we don't have as good of data or regularly assessed data. But we can look at how people how systems are working or not working and focus on outcomes at that level. The second is that the strategies have to add up and align partners with metrics that give everybody a line of sight from their work to the ultimate result. If I'm in the coalition, I should be able to see how the activities I've committed to, if I do those, they contribute to moving strategies that move the overall result. And the strategies have to add up. Again, if I'm trying to move outcomes for 500 people in my community, I can't have a program that's just for 25 people. It's like, what would it take to move at that level? And finally, we have to have some type of work plan that sequences partners' implementation of the strategies to support accountability. How do we make sure that everyone knows exactly what they have to do and that we can manage across multiple organizations doing the work in a transparent and clear way? So I'm going to talk more about what does it mean to create that clear strategy. And the process we use comes from result-based accountability, which is a process that initially was created by Mark Friedman and worked with Annie Casey Foundation, and the Casey Foundation has built on. But it's a process that we found for building these kind of common agendas really works well at population change. And the way we think of how most efforts have typically moved is that people see a need, they create some type of program to meet that need, and they start measuring outcomes. And then at some point, they're asked to create a logic model. And the logic model is usually something like this. If we grow our outcomes and there's other programs in the community, and we work with them to kind of share best practices and they keep achieving more outcomes and we all improve our outcomes, that wall off, we just do all that, boom, we'll get to population change. Except for it never happens that way. We end up with the story I told earlier of lots of really great programs serving people, but at a population change, we're not seeing change. And so a result-based process kind of reverse engineers the way we're used to building these kinds of plans. We start with defining a clear result population indicator. What is the metric or indicator we're trying to move? Who's the population we're trying to move it for? Is it citywide? Is it a neighborhood? Is it a population with certain characteristics? Is it a region? But what's the population boundary? What's the result we want that population to achieve? And what's the indicator that will tell us if that result is being met? Then we have to look at are there subpopulations who experience different outcomes? And so this is where we can investigate and look at within that overall population, can we shrink that N or number it all? Are there within the community pockets by zip code or other differences or geography or what have you, that we can disaggregate data to look at and see, are there subpopulations that experience more acute differences? And how do we make sure we can target those differences? Because our goal is to move everyone toward that common result. How do we make sure that where there are differences, we can target work to move everybody to that result? So really being clear about who the populations are and digging into that population. Then we look at what are the factors that support and impede that result. And think through, like, what do we know that exists now that is getting in the way of people achieving that ultimate result that we're seeking? What are the factors, especially the systems factors, and I'll talk more about that in a minute, that are supporting and impeding people? And then we look at those factors and we ask which of those factors, if we address, would have the most impact on moving our result? And then which of those factors would we as a coalition have the most influence on? And that's where we target our strategies, at those factors that we could have the most impact on and the most influence on. That's where we have the best chance of having impact. And that's where we build our strategies. And then every strategy has to answer 3 questions to be a strategy. How much, how well, and what difference? Is this a strategy we're going to do with 50 individuals, with 500 people? Is this a strategy we're going to target at 3 schools, at 30 schools? How much, what's the dosage of the strategy? How much will we do? Then how will we know it's working? I was just working with a community in Colorado in public health that's working on stigma mental health. And they're talking about doing some type of outreach campaign. And we're talking about the how much being, they could count the number of activities and interactions they have. That's fine. The how well would be how many people, how much increase is there in people utilizing or reaching out to the resources in their community? And what difference would be how many people actually, is there an increase in people using those resources? So the strategy has to be able to answer those 3 questions so that you're clear on how you're targeting the work and how you're making sure you're doing the right work and that it's having impact. And so we see a lot of groups do public education campaigns. They're not sure what happened. But if you don't have those how well and what difference measures, you're just putting things out there. You don't know if it's actually working, which would be the ultimate result. And then once you've done that, then you ask, who's all needed to implement the strategies? Again, the form follows the function. You might have strategies that call on bringing in new partners you haven't had before. You might have strategies that some of the people who helped you plan aren't included in it, and that's okay again, because we're not serving the group, we're serving the result. We're getting the right people around the right tables to do the things we've decided is the most important work that can move our ultimate result. So this is kind of the stepping stones of building a result-based strategy. And again, it's steps you go down, not up. You don't start with who you got and what you're already doing and build on it. You start with what's the result we're trying to move, what's in the way, how do we target that, what do we do? And again, when you're building strategies, you'll look at what are evidence-based examples from other communities. You'll look at what are we already doing, who's already aligned with the strategies that are emerging in this community. So it's not abandoning it. It's just not starting with that as the beginning. So in terms of building and defining that result, just a few notes here. One is that when we think of what's a good result, we think, what's the change? We want to make sure there's some sense of urgency around it, that people really believe it's a really important issue. We're clear about who's the population that'll be better off. And that we've got some measures we can use to track progress that's regularly available and be disaggregated. And so for us, those are kind of the qualifications. We also think that a good result has communication power. It's something that, again, without using technical language, people can understand. that there's a sense of broad and urgent sense that it's important in the community. That proxy power is the idea that data tends to run in a herd, that maybe we can't find the exact data point, but we could find contributing data points that would give us a good sense if this is moving in the right direction. So in a community where they're concerned about the growth in suicides, but there's not a lot, are there contributing metrics they can see among teens where they might see school belonging or other factors that, if that's moving in the right direction, might give us an indication that there'll be fewer potential attempts? Can they look at use of certain services? Again, are there proxy indicators, if there's not a perfect indicator, that would help us see that we're making a difference? And then again, are we able to get quality regular data on that indicator to assess progress on a regular basis? When looking at the factors and building strategies, we think looking not just at programming, but thinking about systems change, which is about changing the conditions that often hold the problem in place. And there's 6 types of systems factors that we often look at. The first is mental models and narratives, the way that people understand the issue, the way legislators understand the issue, the way the media covers an issue. We were working on infant mortality a few years ago, and we looked back, and the local newspaper always reported incidences of deaths at the home, and that's what most people thought the issue was. But the data showed that 65% of the infant mortality actually was a result of prematurity, 25% were birth defects, and less than 15% happened in the home. But so much attention was being put on the home piece and not on the factors that supported getting babies to get and mothers to get to full term. We met with the editorial board of the local newspaper and shared with them 5 years of their reporting and showed how it had created a distorted view and how that distorted view had even impacted the way that legislation was introduced on the issue. And the next year, they changed the way they reported and covered the issue, including the community's annual fetal infant mortality report. The headline was about prematurity. And again, we looked at changing mental models and narratives about the issue because the way people understood it was totally different. We had another example of stigma around mental health in a rural community in Wisconsin that had high suicide rates, with the farmer suicide rates in the country being so high. And they found that the population who worked in that community were often stoic and self-reliant and kind of not very responsive to social service requests. And so they met with the extension office and worked on ways to change the narratives around it. Relationships and connections is another one. That's the factor where the disconnections between providers, if kids are struggling at school and they all go to the same after-school program and there's no communication that says, hey, these kids are running a little behind, can you do extra reading practice with them? Or if we're that example I gave on eviction prevention earlier, or in northern Wisconsin, where there was a problem with it's a very rural community, and people with acute mental issues were often whisked away to hospitals far away, and they came together and created these catch plans, these crisis intervention plans, with individuals that were kept in a central place that hospitals, police, and others could access. So if someone is having an acute issue, they could access that person's plan, and all of these systems could coordinate together to support that person at that time, versus it just being the default that the police pick this person up and take them to a hospital an hour away from the community. Power dynamics is another one. Who has voice on the issue, how people are listening to the issue, and how people inform an issue. People with SMI and SED often experience housing insecurity. One initiative engaged residents in figuring out how their needs were different than other housing needs, and so they could influence housing policies. And so bringing that voice and that perspective into decision-making so we're not left out, that can be a system barrier when our issues aren't on the table and aren't understood. Resource flows is about the way that money comes to an issue. And so, for example, you know, we had a collective impact that was starting up, and then the city issued an RFP that was going to force everyone to compete with each other. And we were fortunately able to go to that city department and ask them to withdraw it and bring in something that would align people. A lot of times the rules around money or the way money flows into or how much money is a system factor that's preventing change. A lot of times it's the rules, though, around how money's used and the requirements and restrictions that can actually prevent people from doing the collaborative work or the innovative work needed to solve problems. Another factor is rules and practices. And what we mean by this is these are the things, the ways we've always done our work that might be getting in the way. We were working in a community in California that had high rates of child abuse and neglect, and had been a fast-growing community that's population had increased tenfold in 30 years. And when we found out that there just weren't a lot of youth programs. They had not scaled in the 30 years with the number of people. And so there was just not a lot of programs and opportunities that supported families. And one that did was their local Parks and Rec department ran most of the summer programs, but they still required families to register their kids during normal business hours and actually a fraction of normal business hours on site. And this was a huge region that it could take as much as an hour for some people to get to that office. And it would, a lot of the people who most need that help couldn't access that because they couldn't get off work to get there during that time. And especially the technology and everything we have today, it limited people. And it wasn't a policy, it wasn't a resource issue, it was just the way they'd always done it. They'd always had sign up the same way. And that rule of practice was blocking people from getting the help they need. And finally, there's public policies, which is the policies and rules within legislation or administration at a city, county, state, federal level that might be getting in the way of work or need reform in order for people to get better served. And so when we look at the factors that our strategies address, we have to pay attention to those system factors because they often are one of the things that most gets in the way of serving the communities that we work with. And these are just these slides, which I think people have access to, just are the examples I just shared about these issues and the ways that these systems work. In terms of building strategies to address these, if you looked at the factors, especially the systems factors, we see a lot of groups get too spread in. We think that it's great to find a set of strategies that we think together, a relatively limited set of strategies that together we think would give us the biggest impact on moving the population to our result. We think it's important to looking at what are best practices or evidence-based solutions that other communities have done related to our priority factors. We want to make sure our strategies be targeted at specific factors to ensure that we have no differences in outcome achievement among populations. So how do we make sure that all people will succeed? Are there specific differences within our communities that we can target work differently to make sure everyone gets to that result? We want to know, is anyone currently doing this or well aligned with these strategies that could be low-hanging fruit for aligning with and maybe expanding or partnering with to move these strategies? And again, do we believe that this set, if deployed together, is sufficient to move the change at the level we've committed to? And again, there's that question for every strategy: how much, how well, and what difference? We've got to be able to answer those three questions. So often we see strategies that are very tactical or very activity-driven, very output-driven. And we think if we can lift a strategy, be able to answer those three questions, it's probably going to be a successful strategy. Once you have a strategy, as I said, you've got to manage it. And that takes some kind of work plan. We work with a lot of groups to create dashboards and work plans to manage once they have their strategies, so that the network has a common thing they can look at to see where they're at on their performance measures and to see what the key activities are to move their strategies, who's responsible, who contributes when it needs to be done, and everybody knows what their role is and what they need to do to move that. Again, the goal is to give everybody a line of sight on how their strategies move results. So that's what a clear strategy is. It's having that clear result that indicator, having done the factor analysis, built good strategies with clear performance measures and a work plan to manage it. If we have that, that's a thing. But then we have to build the coalition to do that. And the form, again, follows a function. The way we typically think of the way of a collective impact structure is that there are work groups whose job it is to manage one or more strategies. And how many work groups is very different, depending on the issue, the community. We've worked with a coalition in a rural community focused on behavioral health that had 1.5 FTE staff, and they had one work group. We worked with a collective impact on education in a city of 1 million people that had 26 full-time backbone staff and had 9 work groups. Again, the form follows the function. What's your strategy? What's the context of your community? And how do we best organize our network to do those strategies? So the blue kind of work group represents work groups who implement a strategy. And again, you look at how many strategies you have. And if it's the exact same group of people who'd be implementing 2 of the strategies, then that work group would work on their 2 strategies. If your 2 strategies would require different groups of people, then that becomes 2 work groups. You kind of decide, again, what the strategies are, and then how do we best organize our group to do this? Is it the same people? Is it different people? The orange work group reflects that sometimes coalitions create a work group that might be a data and evaluation work group that serves the other work groups and the initiative overall. Or they might have an advocacy work group, or they might have other functional work groups, as we call them, that are a group that works on supporting the network overall, but doesn't work on a specific strategy, but works on supporting all the strategies. And again, some coalitions have those, some don't, but it's another way they do. And again, people in the network usually are members of work groups. There's a steering committee that governs the collective impact. And it's important to note their job, typically the steering committee would have 1 or more co-chairs of each work group, and then other leaders, and be a good representation of the network. Their job is not deciding for the network. Their job is stewarding the commitments of the network. The network has built the common agenda, and the steering committee stewards the common agenda that the network has created. So it's not about being accountable to the steering committee. It's the steering committee is holding people accountable to their own commitments as a network. Excuse me. So again, you build the tables around the strategies, not the strategies around the tables. It's important to be clear about and document what's the membership authority and responsibility of each role. If you join a work group, how do people join? What are the responsibilities if I join? What's our authority to make decisions within this collective? Be clear about all of these things. It's important to note again, it's distributed leadership with a backbone, facilitation, support, and management. The work group has co-chairs. The work group has people who lead different work on the strategies. Steering committee governs the work, but also supports the work. The backbone staff is supporting and facilitating. There's leadership all over this map. It's not a hierarchy. It's a network of leaders working together. Tables have both formal and informal authority credibility. So the idea is if I'm building a steering committee, I want to have people on that steering committee who have influence with the systems I'm trying to move and have credibility with the people who have to do the work. We always like to say that everyone in the network should have somebody they can text on the steering committee, or they should, everyone should have someone they feel represents and reflects their point of view and perspective in the group. And so again, we want to make sure that it has the credibility across our network, and it has the credibility across with the people we have to influence and the people who have to do the work. The work groups, when they meet, they don't meet to report to each other on the programs at their various agencies and to give rah-rahs. They meet to use the work plan that I showed you earlier to assess where they are, to plan, to coordinate, learn, and improve. So work group meeting isn't sitting across from each other reporting on the work of our agencies. It's looking at our strategy, asking, we need to move 300 more kids. We have 300 more kids who are still behind in grade level reading this semester. And primarily they're at these 5 schools. How can we deploy more people to these 5 schools? Which programs do we have to do? We see that this community has this program. It doesn't seem to be working. It's doing that. It's problem solving and building and thinking forward. We always say, if I'm only reporting on what we've done the last few months, that's an email. The focus of the work group meetings should be planning and coordinating the work going forward and assessing what we've done, not reporting all the rah-rahs of everyone's work. And again, remembering that you're governing a network, not an organization. Get out of the Hilton model and into the Airbnb model. Not an endorsement of either product, just a metaphor again, but like the idea of, remember, the steering committee is not governing an organization. They're not governing the backbone to do the work with advice from the work group. They're stewarding a commitment of the work groups to implement the agenda, and the backbone staff are coordinating, supporting, and managing work group members to implement the agenda and report back to the steering committee on how they're doing and supporting that. Finally is the culture piece, which again is how do you build a culture that supports people within that form of network to move a strategy together. We wrote a paper last fall called Backbone Leadership is Different that identified the skills we saw that effective backbones had. And one of those mental health groups that I mentioned from Wisconsin was one of the 5 or 6 groups we featured in that article, where we talk about 6 groups that have done this really well. One is that we have to keep everyone aiming and making progress on a build result, that the great backbones are really good, and making sure that everyone doesn't get trapped into only thinking about the program outcomes, but keeps their line of sight on that ultimate change we're trying to make, and is constantly seeing that change and focused on that. We have to align groups with different approaches, relationships, and competing interests. That's hard work. Again, that's where, there's a lot of brokering and relationship building and trust building and negotiating that happens within these groups. We have to guide leaders to change their beliefs, actions, and programs. Again, I talked about that change management. Backbone leadership is a change management process. We have to create a culture both of belonging and accountability. We have to get people to believe that they're fairly treated, that their perspectives are valued, that their contributions are valued. And we have to hold them accountable to that work plan and make sure they're getting the work done that moves our strategies and results together. And systems are critical to manage all of this, but the work's relational. One of my clients last year, they kept having challenges with members. And every time they would tell me about these challenges with their members, I'd say, did you call them? And they said, well, I reached out to them and I emailed them. I'm like, did you go to their office and see them? They're like, no. I said, you need to go talk to them. And they found this cartoon somewhere, and this client sent it to me. But what we found that the experienced backbones did really well is they visited and toured their partners' organizations and programs. They got to know their work and got to know them and got to know their interests. The group in Appleton that worked on behavioral health, they said they always broke bread with a new member before they attended the first meeting. They would make sure they had coffee or a lunch or something just to get to know them before they came to the first meeting. They checked in with partners on progress weekly. They're constantly checking in with people on how things were going. They weren't waiting for people to report. They were just constantly in communication with folks. They showed up at partners' events to support them and even volunteer to show that they were here to support them. Again, the partners don't support the backbone supports the partners. And they championed and celebrated partners' work continually in meetings and communicated. The rah-rah wasn't allowing people to share all their stuff at every meeting. It was in communication at the beginning of the meeting, naming some of the big successes or contributions people had done and cheering it and celebrating it, and then moving to the work. But it's a piece of it is we're constantly championing and celebrating. Building collaboration requires doing work differently. It means, again, keeping everyone focused on the result. We think it's important for a group to have some core values or ground rules that the group's created. And those are only useful if you keep them in front of a group. So in our experience, when you create those, one of the things that we often see is people do it as an activity and it goes in on a poster somewhere, it goes somewhere. But what we think works better is if you create those, put them on every agenda, review them at the beginning of every meeting. Ask when making difficult decisions, how does this decision conform with it? If you actually use them, they're far more powerful. And then it allows you to hold people accountable for them better. And one activity we often do is we have people start out, if they're a new group, and we have them at tables make lists of if they were to put 3 or 5 practices in place to make sure they had a completely ineffective, dysfunctional collaboration, what would they do? And people come up with that list pretty easily and pretty quickly, right? And then we look at that list and say, okay, what are the 5 or 6 things we as a coalition could do to prevent this list from showing up? And we create that. And then if I'm the facilitator, I see people breaking those agreements, I'm not holding them accountable to me. I'm holding them accountable to what they said they want and to prevent what they don't want from happening. And that's the important thing. I'm not facilitating to hold you accountable to me. I'm holding you accountable to your own commitments and agreements. You built this. This is what we're holding accountable to. Building relationships and fostering relationships is really important to collective impact. How do we create space to do that? Having routines and consistent meeting agendas and processes is something we think is really important. We often work with our clients to create, they have a similar agenda they use at every meeting, at least in terms of protocols and process. And we do a lot of in the celebration realm and things like that. But in the routines, one of the things we think is really important is if we want groups to collaborate, please don't put them around some giant long table together. That supports extroverts. It supports people with the most influence. It gets wallflowers to wallflower, and it gets the extroverts to speak out. We think the best collaboration happens around smaller tables when we engage people to actually use these meetings, have them do most of their meeting in small groups, not in the big group. And you get way more done, you get way more energy, and people feel way more productive. And then if you're hosting meetings, hospitality matters. How do you welcome people? Do you provide them anything? How do you serve people at the meeting? When we facilitate as outside facilitators, we often bust the tables during the session. We want people to feel served and taken care of in the meetings. And all those small things add up to make people feel like this is a place where they're cared for, where they belong, and where they can do their best work. The other thing is that trust is important. And trust doesn't just happen. And often we build a coalition, there's some sense of distrust or maybe suspicion of trust among people. And you've got to pay attention to that and to build it in a group. It begins with if we as facilitators are authentic and sincere and self-aware, we can talk about some of the challenges we've had, or we share things we've done, or we open ourselves up and share our experience. It allows others to open up and share their experience. If we ask people to do something, we can show we've done it ourselves. That lets people know that we're not just telling them what to do, we do it. Recognizing people's assets. When people know they see your contributions, when they know that they value what you bring, they're more willing to listen to constructive criticism. They're more willing to hear different ideas or alternative ideas from you to what they propose. If you never recognize or value them, they're not going to hear that the same way. Empathy, the way we demonstrate as leaders and facilitators that we center others, that we're not just focused on ourselves, our experience, our interests, we understand their experiences, their interests, that we know that this organization is going through a difficult time, and we contact them and say, hey, do you need to pause on some of these actions over the next quarter? Like just letting them know we care, letting them know we see them, that makes a big difference in building trust. Having those clear agreements, as I talked about earlier, whether it's ground rules or having a clarity about how do people join a group, what authority do we have, who are members, all of that stuff, the clearer that is, the better you can manage it. Brene Brown has this great quote that clarity is kindness, and we find it's really true. Reliability, obviously, the more that we do what we say we're going to do, the more people will trust we'll do it. And if we have distrust, sometimes we have to pursue that reliability in a very kind of open way that makes sure that people see it, even narrating that. You know, we heard that you expressed this concern. Here's how we addressed it and what we did to support that. Letting people know that when they express those concerns, or if they criticize something we've done in the past, we've learned and changed, and demonstrating that change to them, that helps build greater trust. Consultation. For anyone who's supervised people, we all know that if I've got one employee and they when they get stuck, they don't ask for help, that when they never ask for feedback, they never check in on progress, I'm probably gonna have to lean in and micromanage more. If I've got another employee and they check in to make sure they're clear on expectations, they let me know how progress is going. If they get stuck, they let me know. That is far easier to manage. I'm going to trust that person a lot more. And it's the same thing. The more we consult and check in with people, the more they trust we're not going to go rogue. Transparency is an obvious one when the more that we're clear. And that doesn't mean we have to share everything with everybody all the time or everyone has to know about every meeting. No. But kind of follow the rule, nothing about us without us. That no one's making decisions about someone else's work without them. And that when we're changing things or moving things, we're being transparent about our logic and reasons for doing them. And finally, take responsibility, own mistakes, failures, and lessons. We worked with a large institution in a community that had historically not really had great community relationships. And it formed a community advisory committee. And at its first meeting, we told them they needed to kind of own the failures and no, we want to move forward. We want to move forward. Say open meeting. The whole meeting was community members bitching and complaining and attacking them. And we said to them, if you own your past, then people can move forward. If you don't own your past, then they're going to be stuck there. And so if you want to move forward, you've got to be able to own your mistakes and failures of the past, share how you've learned and how things are going to be different. And that's how you begin building trust. You can't sweep it under the rug and hope to move forward. So I share all this because we think trust, they say collaboration moves at the speed of trust. And we see so many coalitions we work with who just try to pretend that everyone trusts each other and don't actively look at it something that they have to manage, build, repair, and support. And that's really important in any coalition. Just a couple more things before we go to questions. And again, one of the examples from our advancing behavioral health work was around getting hospital administrators and people with lived experience who work at the same tables. And how do you get people to see that if we're trying to move this result, we're going to need to work differently than we have in the past with different people at the tables. And to have the credibility to do this, we're going to have to learn to trust each other and work, which means we've got to do relationship building. Again, you can't just put people in a room and hope they'll get along. You've got to nurture that. You've got to foster that. Are you taking them out in small groups for meals? Or are you building a buddy process? Or how are you orienting everybody and helping them understand each other's perspectives and language and experience? Like, it's not just putting people into a space. It's actively building that trust and engagement around them. Another piece is community engagement. And community engagement is really about how do we get the people, we always say those, the intended beneficiaries of our work, those we serve, and their families, friends, and neighbors. It's about how do we engage the people closest to the issues in the solution of the issues. The International Association of Public Participation created this spectrum that a lot of people use and we found helpful to think about 5 kind of levels of community engagement. The far left is informed. That means we make decisions about a community and then we orient them to the change. Consult is we're going to get some feedback before we make final decisions from the community. And then our responsibility is to let the community know how their feedback may have shaped our solution. Involve is at every step of our process, from defining the problem to exploring options for solving it to choosing options and thinking about it. We've engaged community members every step of the way in our process. Collaborate is really sharing power. A collaborative initiative might have a governance committee that's half people with lived experience and half providers. And it's really sharing power about decision-making with community and about the co-creation. Empower is the intended beneficiaries, families, friends, neighbors make all the decisions, and our role is to support whatever they decide. So when we think of this specifically in terms of your work, an inform would be that we again, we make decisions and inform people about the services and programs offered. Consult as we might survey or do focus groups of people to find out what they think before we make decisions. Involve is that we recruit people and their families to help us start co-developing services, find others in the community to participate, and provide continual feedback. Collaborate would be that we form an advisory board of individuals or we create a governance table with people with lived experience and people who are providers, that we create co-leadership. And empower would be that, again, that we work with peer-led family-run organizations that support people, and we support whatever they're deciding. Again, we're not vetoing them, we're empowering them. The important thing here is to be clear about where your commitment can be on the spectrum. It is not the case that it's not only spectrums where the goal is to get everyone all the way to the right. The goal is to figure out, based on our results, based on our community, based on what we're trying to move, what's the right place for us to be, and then make that promise and fulfill that promise. The biggest mistake we see people make is they use the language of collaborate and empower while they develop something between inform and consult. We think if you're only going to consult, then name that and say, listen, we're going to survey and listen to residents, but we're still the decision-making table, and just be real about that. Each step along the spectrum means shifting more and more power away from our organizations and systems to people. It's often been the case in our experience that each step on this continuum means more capacity building and support. The groups that do collaborate and involve and empower really well put money behind it and resources and staff behind it, so that they can make sure that they get more people involved. We worked with a K-12 effort that wanted parent engagement to be key, and they had 4 full-time staff. When we worked on infant mortality in 6 zip codes where we were trying to move outcomes, there was a community liaison in each neighborhood. Trying to shift power and move more people into decision-making and engagement often requires more capacity building and planning. Just 2 last things here. One is just recognizing that leading a collective impact means holding tensions. That often it is the case that when you're managing a coalition, your job is not to resolve the tensions. You've got a lot of interests at the table. The job of the leader, in this case, the backbone leadership and the steering committee, is to hold those tensions, not to resolve them. We always say if half the group thinks we're moving too fast and half thinks we're moving too slow, we're probably going at the right speed. So a lot of people say we have to do change from the top down. We've got to get the right people, the most powerful people at the table. But we've seen that often top down doesn't work and bottom up doesn't add up. That you probably need to have the credibility with people in the community, and we have to have influence. We have to find that. But again, having both of those means there's going to be tension in the group, and we've got to hold that. We have to right size the amount of process and engagement. Again, think of it as spectrum. How much engagement can we do without losing momentum? We have to have momentum and progress and get some quick wins. And how much engagement can we do while also making sure we get some momentum at the same time? And then again, we want to hold that agenda we've agreed to. We have to also be looking for innovation. And there's some tension between holding what we know are the commitments we've made and enabling some innovation, but not allowing that innovation to move us away from the strategies we committed to. So we want to be both holding the agenda and doing both. It's often holding both of those things, and the job of the leader is holding those tensions and being okay holding those tensions because it's the right way. And finally, when I over the years built a list of the 10 things that often go wrong in collective impact. And those 10 are when we commit to a strategy and we let it drift. We all create this common agenda, and then a new funder offers an RFP and we all shift away from it, or we start going into programs and we start moving away from the things we've committed to. That not holding the strategy is a big danger. The second is culture drift, that we build those agreements, we build that culture around our meetings, and then our meetings fall back into being just reports, and we fall back off of the kind of culture that supports a trusting coalition that can make hard choices. The third is treating work groups like committees, that we just get around a table and people start advising the backbone or reporting on their organization's work rather than doing the difficult work at the table to coordinate, manage, and facilitate work together to move the agreed upon strategies. The wrong people at the table, that either the table might be too top down or bottom up, or the table might not reflect or represent the communities we're serving, that we've got to really, sometimes we've seen that people, we work with a coalition and they were trying to move something at city level and they had no one in their coalition who had influence with anyone in city leadership. And we're like, you can't move change if you don't have influence with the people you're trying to change. We've also had people that were very top down and none of the programs had any credibility and no one was following the work of the coalition. It's getting the right people at the table to move it. Lack of inclusive transparency, we've already talked about trust, but if there's a sense that there's a meeting before the meeting that's the real meeting, coalitions fall apart quickly. Lack of accountability, if we let groups just keep doing what they're doing and we don't hold people accountable to the work plan, to their commitments, if we're not holding our coalition accountable to that ultimate change, things fall apart. Funder and political hijacking, this is when, and I gave an example earlier of when a group is building change and all of a sudden we worked with a coalition that was working on housing in a community and they had 27 meetings, over 1,000 residents. They had over 50 nonprofits involved. They built this agenda. The mayor goes to a conference. Here's a speaker, comes back and says, I want to do this instead. And fortunately, there were people in that coalition who had influence with the mayor and got them back. But there was a chance for the whole agenda to be hijacked by the mayor from what all these groups did so much work and data-driven work to pull together. Managing a network like an organization, this goes back to that issue of like, are we operating like a Hilton instead of Airbnb? How do we make sure that we're managing ourselves as a network and not an organization? Insufficient timeframes. We often find that moving population change is a 5 to 10 year effort. It's not a 1 to 3 year, it's a 5 to 10 year. If we're not committed as a coalition to staying in for the long term, it's really hard to move. And finally, lack of adaptive leadership. I talked about holding those tensions and managing people through change and continuously learning and improving. All these things require us to have the skills of adaptive leadership to do. And so with that, realize it was a lot. I think the slides are being made available to people. And I'll just share, there are a lot of resources at the Collective Impact Forum, which is a free network. Anyone can join and access all those resources for free. I did a community engagement toolkit that's on there if you're interested in that piece. That paper on backbone leadership is there. The paper on the 10 dangers is public. A lot of the resources shared are all things that you can access freely and are all available at the forum and available from the resources each of us have done. So feel free to dig in more. And I'll open up to questions.
Paul, thank you so much. That was so enlightening. And we have a bunch of questions here today. So I'm going to turn this over to Lachelle Freeman. She is the Federation's sort of in-house expert on collective impact, and she's going to moderate our question session.
Great. Thank you, guys. That was such an amazing presentation, Paul. Thank you. So I'm going to start with a question here. People are extremely distressed currently. How do we keep them uplifted and optimistic?
You're starting with the easiest question. That's great.
I know. I just didn't want it to end without approaching that.
Yeah, I mean, this is the adaptive work, right? And the way that I think of it is there's a business book that's kind of a classic in the business genre called Good to Great by Jim Collins. And in it, he talks about something called the Stockdale paradox. And he talks about Admiral Stockdale, who was a prisoner of war during the Vietnam War. And what he said was that those prisoners of war who every day were distressed, thinking they were going to die, didn't make it. Those prisoners of war who every day thought they were going to be rescued, didn't make it. Those who faced the brutal facts of their reality and confronted those brutal facts head on but had also held ultimate faith they would prevail were the ones who made it. And so the Stockdale paradox is the paradox of both confronting the brutal facts of reality and holding ultimate faith will prevail. And I think in these moments, we have to hold both. And if you miss the hope, that's hard. I can look back at the history of this country and see lots of times a pastor in my community who I'm friends with, Walter Lanier, began a meeting this winter. He said, don't tell me that we have it harder than my ancestors. And I think that this notion that we've been through hard and difficult and distressing times before, and we've come through. And we have to hold the faith that we can move through these times. And the other thing is that a lot of our work and the issues and things we've done have lasted for more than 2 years or 4 years, and they'll last another 2. So like the work we're doing is longer than the periods of time that we may feel distressed about. And so I share that distress on one hand, and I also share ultimate hope that I believe that we will prevail in moving the work we do. And the last thing I'll just share, which I think is incredibly important, is in this environment, it can be very easily to be distressed about our work. But just remember one thing, that if you look at public opinion polling, what are the things Americans are most concerned about? Affordable health care, affordable housing, affordable behavioral health options. We can look in communities. I just saw a poll from somewhere that about behavioral health access being a big issue. So much of our work remains enormously powerful and positive and popular. And while at a political level, it can get controversial, and I'll leave that there, at a community level among people, I don't care what community you're in. I've been to, in the last 20 years, I keep account, I've been to over 139 cities in the US. Almost every city, what I hear about is mental health, kids' reading scores, affordable housing, and affordable childcare. I can go to almost any community in those 4 issues. I don't care who I'm talking, those are the 4 issues that can come up. And behavioral health and mental health has been one everywhere. Rural, urban, large, small, red, blue, it's a concern everywhere. So I think while distressing and despairing, remember that the work we do is enormously powerful, needed, and positive and popular. That the distress about the current situations and budgets and all of these things, and the division in our culture, that our work will last longer than those divisions, and that is important and continues. So that's my message of how to deal with that. And I think it's like the distress is real. Like I don't want to I don't want to be at all like gaslighting about what that is and means for so many of us and the threats and concerns a lot of us have. But I think we have to take that view that we will prevail.
I agree with you. And I strongly believe that perspective is everything. And also that kind of lines up with what you were saying about collaboration moves at the speed of trust. So within our communities, we have to trust that this process will, go through. So let's go to another question. We have a lot of questions. We'll get through as many as we can. So it says, since network members are at different levels of service, funding, and staffing, how do you keep or monitor that everyone is performing at the same level?
Yeah, so they're not. I think that you have an agenda and you have a set of strategies, and people have different responsibilities based on their capacities for those different strategies. I'm not asking everyone to do the same thing, but if I've got a youth center, if I'm just going to pick a simple issue, if I'm working on grade level reading and I've got one youth center that has 300 kids after school every day, and I've got a church-based after school program that has 15 kids after school each day, I'm asking that if that faith-based effort could still use the same after school reading mentoring program we've agreed is the evidence-based model, and I'm asking the place with 300 kids to do the same, and I'm hoping both of them will implement that model at the different scale and capacity they have. If I'm working on moving more affordable housing production, I've got some developers who can do more than others. And again, I think it's just, we build the strategy and then we figure out how to mobilize our community around it as best we can, recognizing the different capacities, limitations, and we might have to invest, look at investing more in some of our partners to build their capacity to do things. And that's often a key piece of collective impact also, is recognizing that, like, geez, this organization reaches a population that no one else does, and really effectively. We need to put more resources behind them so that they can bring more of that, because that's going to move our needle if we can move that population. So again, it's looking at that as well.
Absolutely. Thank you. So when there's strategy drift, how do you course correct that?
So I think it's first is to diagnose it. And then second is to go back to our original strategy and say, did we drift from the strategy because our initial strategy was not the right strategy? Or did we drift from it because we just didn't want to do the difficult work of getting there? Yeah. And if it's not the right one, we've got to revisit and rebuild the strategy. If it is, we've just fallen away, then we have to recommit to it and figure out what to do. I would say as a consultant, the number one thing I'm addressing is strategy drift. The most thing I do is I'm often brought in to help people rebuild their strategies because they've fallen off of them and they realize they have to rebuild and refocus. And that's the number one. That's probably more than half of the work I do with clients is on me.
So that's where that work plan comes back in to yes. Review what you initially said you would do. Okay.
Yep.
What are helpful ways to get others to buy into change when no one wants to change?
I'm glad I didn't have my cup at that point. I would have done a spit take. So I think the challenge there is when you've got, one is, again, that culture building. You've got to build that trust, and you've got to build that sense of community among your members. Two, the agenda has to be something that's not being pushed on people. People had to participate in building that agenda, or at least a representative enough group that those who might not have been in the process look at and feel the agenda is credible because of the people who worked on it. That there's people they trust and believe in who are part of the process, and that gives them trust and confidence in it. And then what we have to do is we have to hold up that result. So we have to say, if we're comfortable right now, and I'll think of a recent community, with 46% of kids reading at grade level, that's what our current efforts produce. All of our best efforts currently produce a 46% of kids reading at grade level. If we're okay at that, then we don't have to change. If we really want to move that to 75%, we're going to have to change. So you have to decide, are you committed to the 46% or the 75%? And if you're committed to 75%, you got to be willing to change. And we've got to use that. That's why the result is so important, because that's what we have to keep holding. You notice in the background paper, we said that the background has to keep that result in front of the group at all times. Is that we're not here just to accomplish some neat outcomes. We're here because we don't believe that 46% of kids reading grade level is appropriate. And all of our best efforts have produced that. And it might be 10% with that. I'm not saying our efforts aren't good. I'm saying it's not adding up to what we want. So if we want to really get that to 75, we've got to be willing to change. And so that's the other thing, is we've got to hold that result to get people to change.
I like that. And I like you said something about putting the success on that agenda, like reminding people of the success that you've had as well.
Yeah.
So, okay, let's go to the next question. Do work groups also celebrate the work, or is that at another time or place?
Yeah. I mean, the best collective impacts create space in their meetings for celebration. It's just not like everyone running. I mean, to me, the worst meeting I go to is one where there's 12 people on a table and each person talks about the activities at their organization over the last 3 months. I could have read that. But if an organization got a huge new grant, why don't we take a few minutes at the end of the meeting and celebrate? Hey, so-and-so got this new grant. So-and-so just got recognized by the city. So-and-so just had their 10th anniversary. Celebrate. Maybe even have cake. I mean, there's a group called Lift to Rise in Coachella Valley, California that I really, really love. They do hosting, hospitality, and celebration better than any collective impact I know, and they get real work done. They've moved the needle on changing affordable housing production in their region and creating a lot more opportunity for people. And they've done it with a lot of hospitality, a lot of engagement. You know, the group in Appleton that worked on collective impact there on behavioral health, their hospitality is just impeccable. People come to those meetings, they're just excited, they feel good. And so I think that's something that's really key too.
I agree. We have to get used to that. Sometimes we're just all about the business.
No, you got to have both.
You do. There has to be a fine balance. I agree. Okay. I wonder if, someone wants you to share the link of the article you wrote about effective backbone leadership. If you could share that link, that would be helpful. Or if you don't have it right now, you can give it to our team and we can get that out with the recording and the slides. If someone was interested in that.
I can throw that on real quick.
Okay.
So we should have that right here. I don't know what that first words are, but that link is the link to the article.
Okay.
But I suppose.
I think we probably have about 5 more minutes of questions.
Right.
How does a fledgling...
And then stay on because there's an important announcement about future opportunities at the end. So
awesome. We'll do. How does a fledgling organization become a part of a collective impact process when they are still in the process of building relationships with more established organizations?
Yeah. I mean, I think that the thing is that a collective impact is formed as when there's a network of people who feel a sense of urgency about moving something bigger together. It's not moved. And so if I'm a fledgling organization, if I want to try and get people to do something collective, I start meeting with partners and again, using data to have the conversation about, are we happy with these results? And can any one of us get these results alone and move this change? And if we agree on that, then let's think, who can we bring together to try and drive it? And I think those are the questions. Mm-hmm. And then I think that we often think that you got to look at, could we get folks with resources to back this? Could we get some champions who could help us get the right people to the tables? Do we think there's a sense of urgency about this issue that would bring people to the table? And if we feel yes to those things, then we might be able to pursue it.
I just saw a question that was in the comments right now. Do you have any advice about coming into an established coalition in a rural area?
I think that the question would be, what's my contribution to their result? I'm not joining the collective impact because I want to join a collective impact. I'm joining because I believe that there's a part of their agenda I could implement and help move that will help them get to the results. And that's the way I would approach it is that, again, you build the tables around the strategies, not the strategies against the tables. So it's like, if I feel I have a role and could contribute to those results, then I want to try and get to that table.
Absolutely. And the last question, have you found that family-run organizations make a good backbone organization to move initiatives forward?
I think the key thing that makes a great backbone, one is trust, that they have to be a trusted broker, an honest broker. They have to have the ability to do the things we have in that article I shared, which is to hold a strategy, to hold people accountable, to manage people in a network. They have to have those skills and capacities. They've got to have trust and credibility throughout the network as honest brokers. And when people have those things that are in that article, we find they are very effective. And I think that the kinds of agencies we've seen backbone effectively are all over the place. It has more to do with the leadership in those organizations and their ability. I talk about that thing about belonging and accountability. Can I create a sense that people will all feel that they can trust me and I can hold them accountable, both for the ultimate results and for their work? So that would be that. And again, I welcome people to look at the other things we've written, the 10 Dangers of Collective Impact article, or the Backbone Leadership, or the Community Engagement Toolkit, or the Equity Toolkit, and other things we've built. And I just wanted, before I hand it off to tell the next announcement, to thank Angela and Ann for being able to translate my words and doing so with grace. I realize I talk fast, and they asked me to share a lot of content as we went through the slides, so I appreciate you having done all that. And to Lachelle and Dana and Kelly for helping set this up, and Linda for hosting. So thank you so much.
Thank you so much, Paul. And on that note, I'm going to take it back, send it back to Linda.
Thank you so much. Great answers to the questions. I think I learned as much during the Q&A as I did during the webinar, and that's fabulous. So we just want to make sure everyone knows we have a buffet of more wonderful webinars coming up. Please join us for everyone of these if you possibly can. And thank you again, Paul, so very, very much for what you did today. This was so informative. And once again, thank you, SAMHSA, for allowing us to bring this content to our participants. And with that, I will turn it over to Kelly for final remarks.
Thank you all so much for joining us today. And again, SAMHSA, thank you for sponsoring today's presentation. Please take a moment to complete the survey for us. We greatly appreciate your feedback. Thank you, Paul, for presenting today. I hope everyone enjoys the rest of your afternoon. Take care and stay well.
Thank you so much for attending today. We are incredibly thankful for our presenters and the National Federation of Families for hosting this informative session. Please take a moment to complete the survey that will open as we close the event. This concludes today's session, and you may now disconnect.